As the temperature drops and the weather is getting colder, I'm starting to see more conditions in my office with pain that's related to cold. I'm starting to see more knee pain and stiffness, back pain, a lot of sciatica pain radiating down from people's back into their legs and even down to their feet, more neck stiffness, shoulder pain, and just the flaring up of old injuries. So if this is happening to you, you're not the only person. So we're going to talk about some of these things and why they happen from both a Western perspective and also an Eastern perspective, and some simple things that you can do to help balance that out so that you're not suffering in this winter weather. I'm Dr. Bishara Wilson. I'm a doctor of acupuncture and Chinese medicine, specializing in sports medicine acupuncture. So let's get into it. So firstly, from a Western perspective, when we look at knee pain specifically, we have the synovial fluid, and that's the fluid that lubricates the knees. As it's getting cold outside, we know the cold can thicken things up. And so that synovial fluid in your knees can tend to get thicker, which make the knees feel tighter and can cause more pain and tightness and constriction in the tendons and the joints. It's even going to affect the blood flow, the muscles. Pretty much everything is slowing down. And when things are slowing down and not moving as fast, the body is experiencing that as pain. Second, the cold again is going to constrict the blood vessels. So you're not going to have as much blood circulating to the extremities, to your arms and to your legs, and specifically to your knees. The knees also already have like a small, like a micro circulation to the knees. That's why oftentimes when you have knee pain, it can already be slower and take a while to heal because there's not as much blood flowing to the knees. And with the cold, you're going to experience that even more. One of the things that happens when it's cold outside is that the body will like release less blood flow to the knees and to the joints because it's going to keep it within to our vital organs, to our heart and our lungs and the digestive system and liver and kidneys and reproductive system, the colon, all of these things. The blood is going to stay within those vital organs to keep our body nourished and warm. It's almost like the body is willing to sacrifice, to use that word, our legs and knees and extremities, hands and feet get cold for a lot of people because the body is keeping and preserving and reserving that blood flow for nourishing our internal organs. Next, you have the barometric pressure outside is changing. That dampness and that cold is causing the air and the weather to literally get heavier. And being that we're part of nature and part of the environment, that's going to also affect our own internal barometric pressure. Like a lot of people, they can tell you when it's going to rain or when it's going to snow, or as soon as it gets cold outside, they feel the difference because their body is literally like a gauge that is being affected by the dampness and the cold and the weather outside. Lastly, from like a Western perspective, your muscles are going to get tighter faster with less blood flowing to the muscles and to the extremities, with less chi. Well, we talk about that to chi when we get to the Eastern perspective, but again, with less blood flowing to the knees, the synovial fluid and other bodily fluids are getting thicker. The body is experiencing that as stiffness. And so there's just not more fluid available. It's just colder and stiffer. I think about it like if you ever cook beans. When you put beans in the refrigerator, they stiffen up a lot. But when you take them out and put them on the stove and put them on the fire, it melts back down to a soup. So in this time of the year, that's what's going on with that cold weather outside. The body is experiencing it like those thick beans, and the body is being in that way. When we look at things from an Eastern medicine perspective and for Chinese medicine perspectives, specifically, or even as we say, like a Taoist perspective, we're looking at different organ systems and how they can affect the knees. We're talking about your body's qi, which is your body's vital energy, the blood, which is that nutritious substance, which is the blood. And then it also has other factors and other ways that we think about it. In Eastern medicine, we talk about the balance of yin and yang, or people say yin and yang within the body, and how all of that relates to our knees and our tendons and our joints. So one of the things, just like in Western medicine, we say that cold contracts. Cold stiffens. And so cold is going to contract and cause your body's chi and blood to not flow as well. And when that chi and blood isn't flowing through your channels or through your meridians and flowing to your knees as much, the knees are almost going to feel hollow and feel like that pain and that stiffness and just that contraction. And so some of the things that we want to do is help to warm the body. That cold is also going to go in and can feel like either a dull pain or like a sharp or stabbing pain. The body is going to feel tight. Next, in Eastern medicine, we talk about the effect of the weather, specifically like wind and cold. That wind outside can literally like attack the joints, and that cold can go in and settle in the joints. With wind, sometimes we can experience that as pain that's moving all throughout the body in different ways, but that cold makes it like stay in one place. And so we say that wind and that cold is like congealing and stiffening up the knees. Next, we can talk about cold and dampness, which is dealing with cold. Damp would be things like cold rain outside, or if that iciness, which is literally frozen water feeling and the air blowing off of the ice, snow, hail, other sort of late fall, winter conditions. And we're going to experience that can show up similar to how we would say to like being like arthritis. And so again, that's going to show up with stiff knees, pain in the knees, cold feet, cold hands, and these sorts of things. And lastly, when we look at Eastern medicine, as we move into the winter season, we say the winter is ruled by the energy of the kidneys. And when I'm talking about the kidneys, I'm talking about the kidneys from an Eastern medicine perspective. Doesn't necessarily mean that you have kidney disease, but in Eastern medicine, in Taoist Chinese medicine, the kidneys rule the bones. The kidneys rule the back. The kidneys rule the knees. The kidneys deal with overall vitality. So when you're dealing with folks that are athletes who are or people that have work that they do where they exert themselves, that's going to wear on the energy of the kidneys. We think of the kidneys like the battery pack of the body. And overstress, long-term health conditions and imbalances, overuse of the body. We have folks that are running 20, 30, 40 miles a week, staying up late, burning it on both ends of the candle, working hard. And that's not even talking about the over sexual activities, drinking a lot, smoking, all of these different things, poor diet, mental stress. All of these things can wear on our bodies, kidney energy, wear on the vitality of the body, which can then make us more susceptible to knee pain and even back pain and even reproductive issues, because in Eastern medicine, the kidneys rule all of these functions in the body. So with athletes, when we're dealing with the knees are actually connected to the hips through some long muscles in the front of the body, where we're thinking about our quads, which are 4 different muscles in the back of the leg, your hamstrings. And so athletes that are working out all the time, hitting weights, running, jumping, cycling, basketball, all these different activities are going to cause like overexertion on the quads. And those quads, as they become tight in the cold weather, are going to pull on the knees more and lead to being more susceptible to knee pain and even old injuries resurfacing and showing themselves. We have desk workers, like people who sit at a desk all day. You're sitting down. Sitting is not like supernatural activity to just be sitting in a chair at a 90-degree angle for hours and hours and hours a day. Folks can tend to have poor posture where with a computer, a lot of times people's head is like leaning forward, which is putting pressure on the neck and the joints and throwing off the posture. And with our feet and our legs and our knees being that foundation of the body, that poor posture and poor body mechanics can then go into the knees. A lot of folks actually can feel stiffness after sitting for a long time, and it can take a while for their body to warm up with after sitting for a long time. Next, you have people that have underlying chi and blood deficiency or weakness in your body's overall energy and vitality and blood, which again, as we discussed earlier, the blood and the chi are then not able to circulate as well through the meridians, through your blood vessels to get to the knees. And that's going to lead to that hollow feeling in the knees, dull pain or even sharp pain, stiffness, being more susceptible to being affected by the elements, the cold and the wind and the damp, and all of those different factors that are going on in nature and the weather outside, and how that can then impact our knees. Folks have had surgery on their knees, and surgery in other areas in their joints, either recently or in the past. Any type of surgery can then lead to being more susceptible to arthritis. Arthritis just meaning inflammation of the joints. And so the body is just going to be weaker in that area. So people that have had surgery anywhere in the body, this cold weather can make you more susceptible to pain. And also anyone that has chronic inflammation. With chronic inflammation, you already have poor chi and blood being able to get to that joint. Things aren't getting in or out because inflammation is like a padding around the joints. And so to kind of protect it, to put extra cushion around it, but long-term inflammation is actually like toxic to the body. It can even lead to specific, even like autoimmune conditions like rheumatoid arthritis or arthritis itself, osteoarthritis, where the body is almost attacking itself and breaking down long-term because of that chronic inflammation. So let's talk about some things to help. When we're talking about the cold weather, one of the things, of course, that's going to help is heat. Whether you're talking about a heat pack, I'm not a big fan of microwaves, but they have those heat packs that are like gel, or some are made of buckwheat, where you can put it in the microwave and heat it up and put it on your joints. They have the electric ones, which are excellent. All you have to do is plug that into the wall. That's going to help to heat up the area, help to melt away the pain, help to encourage more chi and blood to circulate to and from the area. Sometimes with the knee pain, it's stagnant and fluids are just kind of stuck in that area. And so that heat is going to help to dissipate that. You can put the heat on at a comfortably warm, hot temperature. You don't want to burn yourself, and you don't want to suffer by thinking more is more. You want to have it where you're putting the heat like on your knees and on your joints for like 15 to 20 minutes at a time. That's plenty. We're dealing with mobility. If you're sitting down at a desk job, you want to get up occasionally. You don't want to sit down for an hour, 2, 3, 4 hours at a time. I know sometimes you could be into your project and working on things and not be paying attention, but you definitely want to get up and stretch. One of a great movement you can do is, put your hands on your knees and rotate in circles in both directions. Take your knees and lift your knee and work to pull your knee up to your chest, or just get up and take a walk around, rub your knees. For folks, if your office is cold, you may want to have a space heater or something under your desk to make sure, or a little blanket or something to keep on your knees too. But with mobility, you want to get out and walk. For different exercises you do, you can do some things like some basic walking, cycling, swimming. For folks that have good knees, running, some low impact things, the elliptical, different things that are just going to help to move the body. And it goes a long way to help encourage that chi and blood, balance out the yin and yang in your body. You want to do warming, anti-inflammatory foods. So this is the season of the year where you want to be upping your ginger. Foods like garlic are going to be great. You want to avoid like your cold foods, so your cold smoothies and salads. You may want to kind of tuck those away some this time of the year. As it gets cold out, you want to put things into your body that are going to support warming your body. So that's again going to be your soups, your stews, cooked vegetables, stir-fried vegetables, roasted foods, baked foods is actually going to bake that heat and actually change the temperature and the quality of that food. When you roast it, it actually kind of just makes it warm. It changes like the chemical composition, the warmth composition of that to go in, and is going to help to support your body with that warmth from the inside out. This time of the year too is when you're going to get more of your root vegetables. Your heavy vegetables is actually also going to help support that foundation, and that food is going to stick to your ribs, as we used to say, and help to warm your body. The cinnamon, things like that. So these are also going to help to nourish the digestive system, warm the digestive system, which is going to help the body to produce more chi, more blood. The warming foods are going to, again, support your digestive system to be able to extract all the nutrients that you need for your body to function. Those heavier foods are also going to be nutrient dense and give you what you need to, again, produce that warmth from the inside out, so that your body doesn't have to work as hard. There's certain herbs, again, that you can take, like ginger. Some people may even do like a ginger compress where you make some ginger tea, some strong ginger tea, and you can put like a washcloth or a hand towel, dip it in the tea, as hot as you can take it, not scalding, but as hot as you can take it, and literally put that ginger compress right over your knees. And that ginger is going to absorb in through the skin and help to promote more blood circulation to the area. More chi circulation to the area is going to help decrease inflammation and swelling, and also help the body to feel more warm from the outside in. And as you're drinking the ginger tea, help you from the inside out. So we're catching it from all angles. Lastly, acupuncture and electric stimulation. Now, that would be coming on in to the office, where the acupuncture is also going to support by helping to decrease inflammation, helping to warm the body, helping to stimulate more flow of the chi and blood to the area. I combine that with the electric stimulation. With the electric stimulation is a slight electric pulse, like 1 hertz or 2 hertz, or different frequencies. And these different frequencies help the body to release your endorphins, which are your pain relieving, anti-inflammatory, mind relaxing chemicals, to biochemicals, um, to help the body to heal faster, help to release any spasms and stiffness that may be in the muscles that are pulling on the knees, and just help to promote more flow to the knees and stimulate your body's own healing process. So, um, if you know that this time of the year that you tend to have more knee pain, which is just starting to get cold, I recommend that you come on in. Give me a call at 888-375-5444. And so you can make an appointment to come on in the office. And there's some other things that we can do around herbs, even if you're not local to Brooklyn, New York, where my office is based, or the city. We can do a phone evaluation and some lifestyle recommendations, even get you some herbs, and some different exercises and different things that you need. We can ship that out in the mail, and you can get that right at your door, wherever you are in the US or in the world. So, again, a couple things you can do. You want to make sure that you're dressing properly. So, wear your long underwear, whatever insulation that you wear, you want to, wear that proper clothing. You may even want to get a long coat that's going to go down to the knees, 3/4 lengths or full length coat that's going to provide that extra barrier to block off that wind and that cold, and help to keep your body heat inside, so that you're not working as hard to keep your body warm. Um, Certain herbs, you can check out my website, manifestherbs.com. I have a joint pain tea on there that's excellent for um, strengthening the chi and moving the chi, strengthening your blood and moving the blood. Has some warming things in there that are going to warm the body, to help with that function. Some things that are also going to help get rid of that excess damp. So if you're affected by when it's cold out and snowy, or that cold, damp weather. And so at manifestherbs.com, we have our joint pain tea. We also have a kidney formula. And again, you can also call me at 888-375-5444 to set up an evaluation, and you can come on in. I accept most major health insurance. So if you have coverage for acupuncture, we can look into that and see if your health insurance covers acupuncture. So there's so many different ways that you can take care of yourself and protect yourself this time of the year. And lastly, you go into the check the link in the bio, and you can download pretty much a synopsis of everything that we discussed today, in a list, and some things that we didn't even discuss today, on ways that you can prevent knee pain as we're moving into this cold weather. So thanks again for tuning in, and I will see you next time. Peace.